am so happy to introduce our speaker for today. Ken Peters is one of our own. He's been with us now for about 3 years, and he is in charge of the Advocacy and Publicity Committee in our chapter. Ken is a retired internal med physician. He was in private practice at El Camino Hospital for 39 years. He served as clinical assistant professor at UCSF in the Department of Medicine, where he taught med students. He has had progressive hearing loss for 20 years. He's been active in our Peninsula chapter, and we love him, and we're so happy to have him do his presentation today. He has been doing his presentations to local senior centers for about a year now, and it's a great presentation. I've seen it a couple times, and I will come every time that you do it because I learn something new each time, Ken. So without any further ado, Ken is going to talk to us about hearing loss in seniors, and you're going to learn some things today, folks. Go for it, Ken.
Thank you, Sally, for that really warm, wonderful introduction. I'm going to start by sharing my screen, and let's see if we get this set up. Good. So we're going to be talking today about hearing loss in seniors. And this is sort of a primer introduction to this topic, but hopefully, even though you've known a lot about hearing loss, that you'll learn something new in this presentation. So first, I'm going to ask for a little survey. I'd like you to raise your hand, and you can raise your hand by using the Zoom. At the bottom, you can raise your hand by clicking on that. And first question is, raise your hand if you suspect you have hearing loss. So everyone who suspects they have hearing loss, raise their hand. Okay. How many people know you have hearing loss? Okay, double hands there for Sally. Think you need a hearing aid? And how many people here use a hearing aid? Okay, well, we have a good number of people here that use the hearing aid. I want to start out with a little comic relief, and this is a frustrated wife talking to her husband, and she says to him, "I think you need a hearing test." And he replies, "Why the heck do I need a hairy chest?" So you can see from the very beginning, this is going to be causing some issues of communication with our loved ones. And this also plays out into our friends and other associates at work. So we really need to learn how to best communicate. Now, these are some other questions that will gear you more towards whether you have hearing loss or not that needs an intervention, such as a hearing aid. Do you feel embarrassed when you meet new people and struggle to hear? Do you feel frustrated when people, because you have difficult hearing them when you're talking to them? Do you have trouble understanding the dialogue on TV and movie theaters, attending plays, or watching internet videos? Does a communication issue due to poor hearing cause you to argue with other family members? Do you have difficulty hearing on the phone? Do you have trouble hearing in a noisy restaurant? And you often ask people to repeat what they say. So if you have yeses to any of these questions, you really have to think about intervening and taking some action on your hearing loss. And we're going to be talking about many of the things that you can do to help with hearing loss. Now, hearing loss is quite common. 1 out of every 5 Americans suffer from hearing loss. By age 65, 1/3 of us have hearing loss. And by age 75, 1 out of every 2, or 50%. So age alone is a big risk factor for hearing loss. And it's something, unfortunately, that we can't avoid. Now, hearing loss is the third most common chronic condition in older Americans. First is heart disease, second is arthritis, and third is hearing loss. Now, I want to spend a few minutes just talking about the normal physiology of hearing. So, first of all, sound waves come in through the auricle or outer ear, which captures the sound waves. The sound waves move down the ear canal and cause vibrations within the tympanic membrane or the eardrum. Now, these vibrations set off the firing of three bones, the malleus, the incus, and the stapes. It's interesting that these are the three smallest bones in our body. Now, the stapes, as you can see here, is attached to the oval window, which is the entranceway to the cochlea. This is a snail-like structure within our inner ear. And what happens is the sound waves become transferred into a mechanical fluid wave which vibrates through the cochlea, setting off hair cells within the cochlea. And I'll show you a picture of that in a couple slides from now. And that sets off firing of the cochlear nerve. And this cochlear nerve goes to the hearing centers in our brain, which are mostly in the temporal lobe, and that allows us to hear. So it's a very amazing system. But unfortunately, in most of us who are listening today, there are problems. And we'll talk about that in a couple minutes. Now, there are three types of hearing loss. The most common one is sensorineural hearing loss, which is a problem predominantly in the cochlea or inner ear. And it's a problem with the hair cells that start getting degenerated over time. People also can have conductive hearing loss, which consists of a problem in the outer or middle ear. For example, if there's earwax in the canal, or if there's a rupture of the tympanic membrane. If you rupture your tympanic membrane, you'll lose about 40 decibels of hearing. So conductive hearing loss is not as common as sensorineural, but many people have mixed combination of inner and middle ear hearing loss, sensorineural and conductive. I would say most of us, though, probably have predominantly the sensorineural hearing loss. Now, what are the causes of hearing loss in seniors? By far, the most common cause is age alone. Genetics play a role. So if your parents have hearing loss in their late 50s or 60s, that would suggest that you might have a predisposition to it. Probably the most important one that we can change ourselves and prevent is loud noise exposure. Now, personally, this is a big factor for me because I play drums in a rock band. And for many years when I was younger, I did not become aware of the problems of loud noise exposure. I would stand right in front of loudspeakers watching the drummers, and that caused problems, I know. So it's important, especially with young people, to be aware of how to prevent this loud noise exposure and to keep the volume levels down, or to wear protective hearing, like things to put in your ear when you are in loud noises. So be sure you muffle the noise. Infection is a less common cause. Sudden hearing loss is a very rare cause. And so if someone wakes up in the morning and they have hearing loss in one ear that's sudden, they should see their ENT physician as soon as possible. This may be related to autoimmune or a viral disease and can usually be helped by early intervention with steroids. In the past, we've used ototoxic drugs such as streptomycin for treating tuberculosis, but we're less likely to see these ototoxic drugs presently. So by far the most common cause is age and genetics and loud noise exposure for most of us. Now, I mentioned earlier the hair cells that are located within the cochlea. And there are two basic types of hair cells. And they basically are in two different rows here. Now, over time, these hair cells become damaged. And unfortunately, even though we've made some great improvements in medicine and hearing aids, we have not found a way to regenerate these damaged hair cells. So with loud noise exposure, genetics, and age, these become damaged irreversibly. There is lots of research being done now to improve this, but so far we have not been able to find a way. Now, this is a typical audiogram, and I want to just spend a little bit of time on this to explain this to you. I believe that everyone that has hearing loss should get an audiogram at some point to determine how severe their hearing loss is. Even if you're considering over-the-counter hearing aids, it's best to get an audiogram. So on the x-axis here is the frequency in hertz. And on the y-axis is the hearing level in decibels. So you can see this is a typical audiogram for a senior, and it looks very much like my audiogram. So in the lower frequencies, the more bass sounds, most of us can hear those pretty well. However, as we get to the higher frequency sounds, our hearing ability is decreased. And you can see here that this measurement here on the y-axis tells you how many decibels you need to hear at that frequency. For example, this is about 6,000, 6,500 frequency, you need 80 decibels, so it needs to be quite loud for this person to hear it. Now, unfortunately, these higher frequencies interfere with our ability to understand speech. And most of the consonants are heard with the higher frequencies, where the vowels are more at the lower frequencies. So for example, hearing the difference between free and flee would be very difficult for someone that has high frequency hearing loss. Same thing with breeze versus sneeze. So you can see where this can really inhibit our ability to understand speech. The other important component is that music appreciation is also affected. So a lot of the instruments that are higher frequency are located in this range, whereas drums and percussion is more likely to be heard at the lower frequency, is not as much of a problem. So this just basically looks at the different levels of hearing loss and how we determine normal, mild, moderate, severe, or profound hearing loss. So for me personally, I have this moderate, little bit closer to severe hearing loss. And it's important for you to know where you are along this continuum. And we'll talk about this in a little while when we talk about choice of hearing aids. Now, we all can realize the problem with not understanding or hearing well, but we often forget that there are a lot of other manifestations of hearing loss that we need to really think about. First of all, there's a stigma that we all know about for hearing loss. And we're all sort of, at least in the beginning, when we start wearing our hearing aids, start being aware of our hearing loss, where basically that stigma can affect us. It can prevent us from getting hearing aids, for example, which can be a very, very big problem. It also can lead to social isolation. depression, loneliness. And these are very, very important factors. And I'll be talking about ways that we can help this by increasing our social interactions. And this is why, for example, our Peninsula HLAA chapter is so beneficial for us, because we're able to integrate and interrelate with other people with hearing loss to prevent the social isolation and reduce depression and loneliness. We also know from recent research that those of us who are hearing loss are prone to cognitive decline and progressive dementia. There is also some very good data that by wearing hearing aids, we can prevent this cognitive decline and dementia. So basically, it's important to wear hearing aids to really keep from getting into this cognitive decline if we don't use our hearing mechanism. Also, we know that people with hearing loss have more falls and balance problems. So if we don't hear well, we're not able to hear other sounds around us that could cause us to move away, for example, an oncoming car at an intersection. There's also associated vertigo sometimes with hearing loss, which can also affect balance problems and frequent falls. So we know that by preventing frequent falls, we're preventing such bad injuries such as hip fractures, which cause a lot of morbidity in our lives. So basically, hearing aids can help prevent falls and improve balance problems. Now, what are some other negative effects of hearing loss? I mentioned the poor communication with family and friends, but poor communication with our healthcare provider is a very, very important problem. I went for my physical exam about 6 months ago, and I have a new doctor, and I told her that I had hearing loss, and immediately she starts yelling at me in a very loud voice, and even gets a little closer and starts almost yelling in my ear. And I told her that it's not something you want to do with someone who has hearing loss, because basically, if you're yelling at me, I'm not going to feel very comfortable telling you about my medical problems. So we are now in a place where a lot of healthcare systems are working on improving, such as with captioning. We know with our ADA regulations that we need to be proactive with our healthcare providers in helping us to communicate better with them. Another big issue is difficulty handling emergencies due to not being able to hear alarms or verbal warnings. And this is extremely important. Even a simple thing like a fire alarm in your home. Many of us can't hear the fire alarm. So we have to figure out other ways to be notified of emergencies. Let's go to the next slide. So we're annoyed when our partners don't make eye contact, talk too softly, mumble, talk too loudly, or ignore us. And I don't know if you could see this, but I'm wearing this little button that says face me and speak slowly. And this is something that I wear at a lot of public functions because it keeps people informed on what is the best way to communicate with me. And this is really important, especially when you're talking to other persons with hearing loss. So when you are talking to someone with hearing loss, it's very helpful to get the listener's attention by facing directly and pronouncing their name. You know, think about the iPhone using Siri. You always have to say Siri, and then she's there to help you and communicate with you. But so by announcing the name first, that can get their attention. Avoid noisy places, choose well-lit settings, don't shout, don't cover your mouth, don't chew, and be patient, rephrase if not understood. So if they ask you to rephrase it's very important to try to talk slowly, directly, and rephrase. Now, what about communicating for people with hearing loss? The key points here is keep calm and do not bluff. So if you think about all the times you've been with friends or family and you've heard, let's say, you think you heard a joke, for example, that someone was saying, but really you're not sure what exactly they said, but everyone may be laughing and you start laughing. So you're bluffing, really. And I will tell you that there have been many times that I've gotten in trouble with bluffing. A friend of mine was telling me about her mother who just had a stroke, but unfortunately it was a loud restaurant. It was not good light, and her face, I could not read her face well. So I said, well, that's wonderful news. And that was a big mistake. So do not bluff. It's better to ask, to rephrase. And although hopefully you're not going to irritate the person you're with, and even if you do, you need to teach them how to communicate with you. Now we're going to talk about types of hearing instruments. Hearing aids it's a predominant treatment that we have. There are two types now. There's a prescription hearing aid, which is provided by an audiologist or a hearing aid provider. And those are for those of us who have moderate to severe hearing loss. Now, in the past 2.5, 3 years, there's been release of over-the-counter or online or in retail locations hearing aids. And these are people, I would say, that have more mild hearing loss or maybe early moderate hearing loss. But if you have significant hearing loss, I really think you're better off going to an audiologist or a hearing aid provider to consider a prescription. And I'll be talking about that in a few minutes, why. For those of us who have pure conduction hearing loss, there are hearing aids that can be put on behind the ear and cause vibration of the skull, which allows us to hear. Now, for those who have severe to profound hearing loss, we strongly recommend cochlear implants. And many people that I have talked to that have had this surgery claim that it's very mild. And basically, you go home the same day. You're never too old to get a cochlear implant. And there are very, very few contraindications. So if things get really bad where hearing aids are no longer effective, definitely consider a cochlear implant. And we'll talk about that in a couple minutes, a little more. These are the different types of hearing aids. By far the most common one is the receiver in the canal. And you have the receiver and then it goes into the canal this way. You can get over-the-counter hearing aids are more likely to be in the ear or in the canal. And for those who have the conductive hearing loss, I mentioned behind the ear, which basically vibrate the bone directly. The differences between over-the-counter and prescription hearing aids, I mentioned where to buy them. You can get over-the-counters in stores and online. You need to go to either an audiologist or a hearing care clinic, like, for example, one at Costco, if you want prescription hearing aids. For those who have mild to early moderate, you can certainly consider an over-the-counter. The prices are really quite variable, but overall, the prescription hearing aids run anywhere from $4,000 to $8,000 for a pair, where you can get over-the-counter hearing aids for as low as $300, $350, up to $1,500. And requirements before purchasing: in order to get a prescription hearing aid, you need to have a hearing exam and a fitting. And this is best done, as I said, by a audiologist or a hearing aid provider. Both are regulated by the FDA, but we know a lot more about the prescription hearing aids in terms of a lot of the research that's been done on them, where the over-the-counter hearing aids are more like the Wild West. We're just learning about the different qualities of each maker. So when we talk about prescription hearing aids, We want to find a good audiologist we can work with. It's best to sample different hearing aids because all of them are a little bit different in what they have to offer. It's very important to have a good fitting. And this is a big problem I see with the over-the-counter hearing aids, is that they do not fit into most people's canals very easily. If you have a very small canal, for example, you're not going to do well with a more generic made over-the-counter, where audiologists will do fittings to make the hearing aid fit exactly. Now, several of the newer hearing aids use AI to improve speech and noise. And this is a new development in the past year to two. And there are certain brands now that are coming out with AI as part of the hearing aid mechanism, which automatically allows you to hear better in noisy restaurants or in restaurants, for example. Strongly consider telecoils in your hearing aids. Now, what are telecoils? So telecoils are little wires that are part of the hearing aid itself. And you can ask your audiologist to be sure the hearing aid that you've ordered is compatible with telecoils. And if it is, I strongly recommend you have telecoils, because this is still the state of the art right now in terms of how we can hear in large halls, airports, or other types of synagogues or churches through the telecoil hearing loop system. And I'll talk a little about that in a couple of minutes. Now, some of the newer hearing aids also have ability to be Auracast compatible. And this Auracast is another way that we are able to understand and hear in large halls. And this is not ready for prime time yet, but will be out in the next couple of years. And this is a transmitter that goes directly into your hearing aid, just like the telecoil does, but the sound seems to be a lot clearer than you might get with a telecoil. And it's a lot easier because you don't have to key in to get to that. It's automatic on your phone with an app. You can just turn on Auracast and it goes right to where the transmission should be coming from. The other thing you want to consider is music appreciation and choice of hearing aids. I have a unique type of hearing aid called an ear lens, which is set up so I have a receiver directly on my tympanic membrane, and that vibrates the tympanic membrane directly, so I get able to hear higher frequency sounds, and it's better for music appreciation. Ear lens is not for everyone, and if those of you who want to hear more about it, feel free to email me, and I put my email in the chat for all of you who want to ask any other questions or get in touch with me. Over-the-counter hearing aids, once again, they can be a self-fitting program by app or website. Always understand the trial period, the return policy, the warranty policies, support and repair costs whenever you consider getting an over-the-counter hearing aid. You're not going to get the same support you're going to get with a prescription hearing aid at an audiologist's office. So most of the time, there is someone you can contact by phone that can help you. But in terms of hands-on support, you're not going to get that with over-the-counters. Now, when hearing aids are not enough, I mentioned briefly about cochlear implants. And these are very, very helpful for people that have severe to profound hearing loss. And this is a little diagram that shows what a cochlear implant looks like. You have a microphone and speech processor, which attaches to your auricle of the pinna here. And then there's a transmitter. And then on the other side, right directly across from that, is a little receiver. And this also receives the sound from the transmitter. And then that causes an electrical stimulation. And what the ENT doctor does when they do this procedure is he filters in this little wire into the cochlea and wraps it around the cochlea. So with the cochlear implant, you're getting an electrical impulse being transmitted through the cochlea. And that directly, without the use of the hair cells that are damaged, by the way, sets off firing within the cochlear nerve, which directly allows us to hear. Now, I want to mention that even though this is a surgical procedure, it takes 1 to 2 hours. You're home the same day from surgery. And it is really considered a mild interventional surgery. A lot of people are concerned about surgery in putting in a cochlear implant. The other advantage of the cochlear implant is that it's completely covered by Medicare, where hearing aids are not, unless you have Medicare Advantage, a Kaiser plan, or a Veterans plan. But most of us do not have any coverage for our prescription hearing aids. Cochlear implants are made by 3 different companies: Advanced Bionics, Cochlear, and Medel. And this is a really good picture of what it looks like. When this gentleman goes swimming, or even when he sleeps at night, he usually takes this part off. And basically, it does not prevent you from doing anything, is what I'm really pointing out, is that you can swim with these if you remove this. Now, I want to spend a few minutes now talking about daily living. And these are some of the basically things we have to deal with on a daily basis in terms of interpersonal communication, use of the telephone, TV, doorbell, and alarm clock. Now, first I will talk about personal listening devices. I'm going to just basically mention first the ancillary assistive device, which is the Roger mic. And this is a picture of what the Roger mic looks like. This is made by Phonak. And if you get Phonak hearing aids, this Roger mic directly streams from here into your hearing aid. So if you're at a restaurant, you can pass the Roger mic around when people talk. They talk into the mic and it goes directly into your hearing aids. If you don't have the Phonak hearing aids that receive this, you can use these transmitters that can work with other types of hearing aids. Now, I want to then focus on alerting devices for fire, smoke, carbon monoxide, and also alarm clock. So I'm going to go over here and talk about this. This is all the alternative ways of dealing with emergencies, as well as telephone calls, doorbells, baby cries. For example, with smoke and carbon monoxide, you can use something like this, which it will tell you with flashing red light that there's smoke being detected. Another one you can use is what's called the flash receiver. And this is made by Bellman and Symphon, who makes a lot of these assistive listening devices for emergencies. And what you can do is plug in a doorbell, telephone, even baby crying, smoke, and carbon monoxide, and there'll be different colors for each of these different connections. So you can use one type of tool with different connections, and it gives you a lot of information. And this is called the flash receiver by Bellman and Symphon. Now, I mentioned hearing induction loops, telecoils, and Bluetooth Auracast. So there are also other types of wide area listening systems. For example, radio frequency, infrared, Wi-Fi. You might see something called Wi-Fi Listen, which is what is being used at the synagogue where I attend. By far the most common one still being used is the hearing induction loop or telecoil. Now, not ready quite for prime time is Auracast, which uses Bluetooth, low energy Bluetooth, or Bluetooth LE. And this has been used, for example, at the Sydney Opera Hall And people were very, very impressed with its clarity of sound in listening to the symphony and opera that was occurring at the time. But there are still a few places that have Auracasts, but we're not really, it has not ready for prime time yet. I think in the next couple of years, we'll see Auracasts. Now, in terms of how to know if there is an assistive listening system within your synagogue, church, or wherever you're at, you want to look for this hearing loop, and that tells you that it's set up for telecoil. And it's very easy on hearing aids that have telecoil. You just push a button on top and it connects you to the telecoil system. You can also see in other non-telecoil systems what are called assistive listening. So they won't have the T next to it, but it will have this still symbol showing that there is an assistive listening device. And by the way, according to ADA regulations, any public place has to have an assistive listening system. If they don't, I think that maybe you should consider some advocacy work to help them and educate them on getting an assistive listening system. Now, we also use telephones and smartphones that are helpful. I think most of you are aware that there is a very good landline that's free called CapTel. And this is a landline that provides captions as calls come in. There are also easy to obtain captions for cell phones. You can use accessibility settings in the iPhone app, or right in their settings, you'll see a hearing accessibility, and you can click on that and get live transcription. For Android phones, you can use Google Assistant. There are also captions and transcription for meetings. For example, as you all know are using, Zoom has captions available. And one of the new developments with Zoom is that they're going to have Zoom captions available whether the host turns on captioning or not. So this will always be available to you. And there's also availability of many, many language translations as well. You can also use another app called Otter. And both Zoom and Otter can provide transcriptions of the meetings, so you'll be able to see what went on. Zoom now uses a very nice AI. We're learning now with our chapter meetings that we do need to check for accuracy at times, but I think we'll be seeing improvement in the AI transcriptions in the future. Most recently, we've learned that there are now caption glasses. The company that we were educated by was called Captify. And these caption glasses actually show the captions, live captioning, when someone is talking to you. It's unclear how good these glasses work in large halls, where there may be echoes or you're far away from the speaker. But I think in terms of new developments, this is a very interesting technology that I'm sure we'll hear more of in the future. For television, most of us are happy using our captioning that's available. It's interesting that even young people who do not have hearing loss are using captioning now on television and, for example, Netflix, for example. And it makes it easier. We can read a lot quicker than we can hear. And what's interesting is that when we try to listen to something, we cannot basically process what we're hearing as quickly as what we can read. And it's almost as if the part of the brain, which is in the temporal lobe, that basically is not getting as much stimulation due to our hearing loss, sort of gets weaker. And there are ways to strengthen that. And I'll be talking about that when I mention here auditory training can be very helpful. There is a very good program called LACE AI Pro, and the website is here. And this is a very good program that I've actually taken that helps you to hear speech and noise a lot better. So it's an actual self-educational program. If you go online, you can register for this. Audiologists will often give you a discount for this as well. So how do we move from here? We have to be proactive with our hearing loss. And although we can go to our audiologists and get hearing aids, we still need to consider other forms of support. I mentioned earlier the stigma, the problem with social isolation, with depression. We need to find ways that we can basically have a group interaction with people who also have hearing loss and can provide us with support. And this is one of the big advantages of joining your local HLAA chapter. Our chapter is the Peninsula Chapter. If you're watching from other parts of the country, obviously you all have local chapters that you can join. There's a national HLAA, which is Hearing Loss Association of America. This is a nonprofit organization. And a very good website is hearingloss.org, which is full of information. In fact, some of the slides that I've got from this talk, I obtained from this website. So consider visiting the national website. And what's nice about this is that you can get so much information within a very short time with this website. Now, for those of us who are interested in evaluations of new hearing aids, hearingtracker.com is a very good unbiased source, and they actually use different hearing machines that actually be able to process how different hearing aids match up against each other. So you can go on YouTube and just put in subscribe to Hearing Tracker. And another very good one is Dr. Cliff, who's an audiologist, who also gives fairly well unbiased opinions on different hearing aids. For over-the-counter hearing aids, there are reviews by Forbes and Consumer Reports as well. Now, getting back to the national organization, HLAA, Hearing Loss Association of America, their mission is to, quote, open the world of communication to people with hearing loss, provide information, education, support, and advocacy. Here's their website, hearingloss.org. They have local and national programs, including a national network of chapters and organizations. They also put out a quarterly Hearing Life magazine that you can get online or on paper if you pay a little more for that. To join HLAA, you can make a donation of any amount. So you can donate $1 and become a member of HLAA. If you want to get the hard copy of the Hearing Life magazine, I think it's $40 or $45 a year. So for $1, you could become a member of HLAA and have all these services available to you and information. They have an annual HLAA convention, which is extremely educational. I've been to 2 of those already, and they've been very, very helpful. There's also every year we do a Walk for Hearing fundraising drive, which I've been involved with the last 3 years. And this is a really good way to meet other people. It's a beautiful walk on the East Bay. For our local chapter here, we go to the East Bay, and it's a very, very good way to raise funds. There are frequent educational webinars put on by HLAA. They do a fair amount of good work with advocacy. In fact, they've gotten hearing aids approved for children in Washington, state of Washington. So advocacy is a really important part of the national as well as our local chapter. There's also a Facebook community and support group as well. Now, for those of us who are in our Peninsula chapter, I've been very active in this chapter for the last 3 years, and I can't say enough of positive things about the people in the chapter, the people that I've met. They've been able to provide for me emotional support. We have a regular support groups called HOPE, Helping Other People Express. And this is led by a psychologist in our group that helps people and support them in this support group, which provides a lot of great support. Technical support is available. We have every month something called Saturday Connections, where we meet on Saturday mornings. And most of this has been on Zoom lately, where we discuss new technology or any other issues that come up with hearing loss. It's sort of something that can be, we discuss, bring up the issues at the beginning of the meetings, and we cover each of these types of issues that are brought up. We also do a lot of networking within our chapter. We have educational meetings every month. For example, this month, we're doing all our meetings now on Zoom with captions. Hopefully soon, when we get a better meeting place set up, we will be doing hybrid meetings where we'll be doing Zoom and in person. We have social events, at least 2 a year, a Christmas party and a summer picnic. I'm in work on the advocacy committee, so I do a lot of work locally with helping people, for example, getting hearing loops in their synagogues or churches, or getting, for example, more support for hearing loss within the systems. The Meniere's support group, I don't think is not active presently. Meniere's is a much rarer cause of hearing loss associated with vertigo and tinnitus. And there is support for Meniere's patients with other people within our chapter that have suffered from this as well. So we often have speakers on Meniere's. This is our HLAA Peninsula Chapter. Basically, this is our flyer. And what this says is these were some of the members of our group. And you can scan this little QR code and go directly into the hearinglossca.org/peninsula website. And what I strongly recommend you do is scan this or go on the website and give us your contact information. We'd be happy to put you on our mailing list, and we welcome new members and welcome you. It does not cost anything to join us, but it will basically open up a lot of new doors for you and pathways to help with your hearing loss. So with that, I'd like to say thank you. And I want to say thank you to a few people that helped me with this presentation. Sarah Oser, who's president of the HLAA North Bay chapter, Ann Thomas, who's president of the HLAA Diablo Valley chapter, Melissa Cruz, who's chapter engagement manager at HLAA National, and of course the HLAA website, which it was also very helpful for many of these slides. So I think with that, we'll be happy to open up for questions. You do have about, I guess, 8-9 minutes left. And do you want to say, let's see if we can, I'm going to stop sharing here. And I guess we can, let's see. Do you want to read off the chat questions there, Sally or Janie? Let me see, I can go on chat myself here. Let me see here.
Do you see any questions on chat?
Okay, no chat questions. Okay, any questions, you can raise your hand. And if you have any questions, feel free to raise your hand. Let's see. Okay, I think Meredith, I can't see your face, but I can see your hand. All right, go ahead, Meredith.
First off, quickly, I
Is
want
that me that you're addressing, Sally? Is that Sally you're addressing?
to know I'm addressing.
Okay, Meredith, go for it, Meredith.
Meredith,
Yeah.
go ahead.
First, I want to tell you that I'm single-sided deaf and have a cochlear implant. And my burning question, which probably isn't, well, you probably can't answer it, but anyway, I'm also a musician. I play in an orchestra. I am having, I want to know, how do I find an audiologist that um, can handle someone who who has my particular needs, which are both speech and music, not just appreciation, but who understands music and the language of acoustics, in addition to the electronics of a cochlear implant. I am facing a lot of, I want to do something different than the audiologist at the moment. And I'm trying to figure out how to navigate.
Okay.
No judgment, no criticism, just we're not speaking the same language, and I need to understand, how do I find an audiologist that's good for me?
Where do you live, Meredith?
Pacifica?
Okay. Because I've heard a presentation recently by an audiologist from the East Bay.
I heard that presentation.
Specialized in music.
Yeah, but he doesn't do cochlear implants.
Cochlear implant.
The problem that I had, and he only said there are 3 in the state of California,
Yeah.
he being one, and he doesn't do cochlear implants. So I doubt that I can actually find an audiologist, but how do I navigate? I'm frustrated, and I'm sorry I'm taking time, but
No, I
my
understand.
language is not, I'm not getting what I need, and I'm having trouble communicating. And, even if I could talk to you after this class, that might be a way for me to start, but I'm struggling.
So I don't have the name of any audiologist now. I know that there are a lot of challenges for music appreciation after a cochlear implant. So I do understand your concerns. Does anyone else have any other ideas on audiologists? That I use a group called Pacific Hearing, which is in Los Altos and Menlo Park.
Okay.
And I can check. If you email me, I can check and see who might be interested. Larry, you have your hand up. Go ahead.
Yeah, I
Can
was
you
going
hear
to
me
say
now? I
that
muted you.
I
Can you hear
was going to
Judy?
say that
Oh,
the
no.
Stanford Ear Institute has a number of audiologists who, that's what they do, is cochlear implants as well as hearing aids, and that's where I've gone. They're very, very good. Uh, I'm sure there are others. I know PAMF, Palo Alto Medical Foundation, has one. I'm not sure where that audiologist is, but there are others in the Sutter Health System.
Okay.
So my real question is, how do I reach out to someone while I have an audiologist? And I'm under the care of one audiologist. I don't know how to ask for consultation in the audiology realm, where one might ask for a second opinion if one is going to a surgeon, but I don't know how to do that for audiology. And that's really what my question is, how?
Yeah, I mean, I think you may have to switch audiologists in the process with someone who's more in tune with what your needs are. So, yeah, it is challenging. We hear you on that, sure.
Can you hear me?
Yes.
You can hear me?
Is that Judy?
Judy.
Yes, Judy, go ahead.
Okay, so I live in Pacifica. First of all, I would like very much to meet Meredith because I've had an evaluation for a cochlear implant, and so I have lots of questions about that for her. And I've been hard of hearing for 50 years. I've been seeing the same audiologist for 40 years. She's amazing. And so I'd be happy to connect with Meredith and meet and share you my experience. And I'm also a speech pathologist and have a major in audiology.
Well, it sounds like I need to
And I finally
meet you. I don't see you on my screen, but I'm thrilled that this whole networking, thing is maybe finally giving me the next, maybe possible next step.
And I've just been evaluated by the audiologist at Stanford, who I thought was terrible.
Okay. Well, you can see where this networking is so helpful, and this is the kind of thing that we offer. And
Yeah, how do I connect with, how can Meredith and I connect?
Well, I think, Judy, why don't you put your email on the chat, maybe, or Meredith, one of you.
I'm,
And then the
I
other
had a
person,
hard time with chat.
sorry. Yeah. put
Okay, I'm gonna hang,
Okay.
I'm
If I
typing
can
mine.
do that, I can put my email in here.
That's it. That's the best thing.
Try now.
Well, thank you. Thank you for your comments.
How do I do that?
Any other questions? I think we're coming to an end of our time.
Sorry.
Hey, Ken,
Kelly, go ahead.
I have a question for Judy. Judy, you said you love your audiologist. Who is it?
Yeah, her name is Darcy. She's with California Hearing Center.
Oh, she's in Kaiser. I don't have Kaiser, but thank you for information. So it doesn't help me. I don't have Kaiser.
She's retired. That's the problem. But she came back one day a week.
Okay, thank you.
I'd like to jump in here for a second.
It's Sally.
In December, when we have our Christmas party, that'd be a great time to come and have one-on-one time with individuals who could give you their opinion about their audiologist. We have quite a few people in our chapter with cochlear implants, at least 8 that I know of, and probably more. So come to our party on December.
Well, unfortunately, that's several months away and my needs are immediate.
I see.
Have engagements that require a certain level of hearing that doesn't exist. Even though I've gotten the backup captioning, I don't feel able to wait until December.
I see. Mhm.
Yeah, sorry. This is immediate.
Yeah, I would love to meet. So I put my email up here.
Yeah, let's,
Everybody get it?
great.
And do you see mine?
Yeah, sullivanjudy@comcast.net.
I
Yeah.
don't see that.
So Meredith, please contact me. I'd be very interested in talking with you.
I don't see your email. I don't.
Okay.
It's in
So
the chat.
it's
Yeah,
sullivanjudy@comcast.net.
Oh, okay, now I see it. Excuse me. I don't see. Okay, I messaged wrong. I messaged
there
to
any
chat
other-
instead of, okay.
Are there any other last minute questions for me before we hand the meeting back to Sally?
No.
Well, thank you very much for your attention. Sally, why don't you go ahead?
Thank you so much, Ken.